Surgical site marking, this is a universal protocol. We mark the surgical site, we identify it. Usually we use a surgical marker to avoid tattooing during the incision. Usually the universal protocol uh, for patient identification start with pre-op. You have to verify that you have the right patient by patient name, and you have by patient name and by patient age and by patient record number. This is very important because missing or getting a wrong patient is concerning a sentinel event, and unfortunately it will happen. You mark the operation site, and you mark the operation details, and we have to do final verifications. We have to confirm everything we do it. We have to confirm that the wound is closed. We have to confirm that there are no missing gauze or something like this. Now we finish the surgery. We came to the pre-operative notes. Operative notes, it's for medical legal purpose, it's very important, and also it's very important for educational purpose. The purpose, you write the operative notes immediately after the surgery, and I advise you to write in the surgical notebook with full details. Operative data including the surgical date and timing, and the pre-op diagnosis, the post-op diagnosis if it's the same. For example, maybe you do a surgery for orbital fractures, for orbital trauma, and you discover there are some dehiscence in the floor, so you need to reconstruct it. And type of general anesthesia, and you write the surgeon name and the assistant, and the estimate of the blood loss, the IV fluids the patient took, and the urine output the patient have, the finding and the pathology if you have, and if the patient has a problem during the surgery, and the complication if discussed later. This is a briefing of the operative data, including the pre-operative diagnosis, post-operative diagnosis, type of anesthesia, the surgeon responsible of this surgery, the estimate of the blood loss, the IV, the urine output, the input output, the finding and the pathology if you send the pathology, and dispositions if you need it. Operative report. The purpose of this report, it will details uh, about the all details of the patient, why the patient is in the hospital, regarding the pre-op preparation and post-op preparation. Usually the operative report including the pre-op diagnosis, post-op diagnosis, the procedures, and the statement of the medical necessity, which is very important. The surgical service for our case, the surgical oral maxillofacial surgery, the surgeon and the assistant, the anesthesia admitted, the operative report, the specimen, if you take the specimen drain, if you are putting the drain, and what is for if you make suction drain, or you have to make non like Belarus drain, the IV fluids, estimated blood loss, the dispositions it should be. Immediate post-operative, it should be written to give the post-anesthesia care unit of the patient, and it should be ensured the early detection of any potential complication like post-anesthesia complication and post-operative complications, especially if you are getting the patient for IMF. The content It should be the details of information of the post-operative, immediate post-operative care, and if the patient, including any finding, can jeopardizing the surgical outcome. Progress note, usually the purpose of the progress note to write is SOAP notes. We are giving the SOAP details in the next slide. The content of SOAP note is subjective. Describe how the patient feel if you have patient pain or something like that. The objective, if you have after the physical examination, the vital sign, the signs, the laboratory investigation, the assess you can do for the assessment of the status with Shan, and what's your plan. For example, if you have the patient with severe pain, you can making a plan for the pain management, including the PCA and including of some additive regimen to decrease the patient pain. Usually we have the post-operative order. It's written to confirm what in details after the surgery, and you plan the patient for discharge. Discharge summary, this is the end of the patient journey in the hospital, and usually you have to stuck to the proper discharge summary, because maybe you don't follow this patient later on, it's followed by other of your colleague, so you have to write all the details including your contact for incoming follow-up, and you have to tailor the adequate follow-up dates with the patient. Usually, the discharge plan, including the date of admission and date of discharge, the admitting diagnosis and discharge diagnosis, either if you have secondary diagnosis, the procedures and the consultation, the present illness, the hospital course details with the patient, and if you have any accompanied need for consultation for other specialty, and discharge medications, and the recall for follow-up and recommended. For example, if you do a cancer cases, you have to refer the patient for chemotherapy or radiotherapy, and what's your plan for follow-up. Thank you so much for your time. If you have any inquiry, I'll be more than happy to answer your questions. Next week, we are going to discuss another topic for hospital-based oral maxillofacial surgery.